Hello and welcome to the annual WriteHive conference, everyone. This year, as usual, is packed with a ton of great sessions for writers, writing professionals, and the publishing industry. Now, WriteHive, for those of you who don't know, is a nonprofit organization serving the writing community with free and inclusive resources, events, programming, connections, and so much more. This 2024 conference brings you this absolutely fantastic session titled Healthcare Systems in Fiction. If you love this kind of content, you're looking for a little bit more on this topic, make sure you check out Writing Believable Emergencies from the 2022 WriteHive conference, which is searchable on YouTube. Before we jump into the panels, I'd love to introduce you to our amazing panelists. And first off, I'm going to have you introduce you guys to Nancy Foster. Nancy, take it away.
Good afternoon, everyone. My name is Nancy Foster. I am half American and half Mexican. I was born in the United States, but I moved to Mexico when I was 9 years old. I did not know how to speak Spanish. I just showed up in the country with absolute no idea what the country is like. I thought it was a country full of palm trees. And I don't know, my parents just dumped me in a school and good luck. And some I didn't fill any courses, so I kind of learned Spanish, having to survive forcibly. My mom is Mexican, so I am half Mexican as well. So nice to meet you. I mostly write in English, but I have a few books that are also in Spanish.
Vanessa.
Hello, my name is Vanessa Lopez Aziz. My first book, Play It Back, is out as of last August. I love that they can have this like beautiful graphic that I can Vanna White at. And my day job is a nurse. I'm a nurse now a little over 10 years. 5 years in the acute setting, in hospitals, doing first bedside and then case management. So planning all the things you don't think of as nursing, like insurance and length of stay, things like that. Then I moved into child psychiatry, and I've been in child psychiatry now for 5 years. And so my real day-to-day job is just getting to hang out with kids during their psychiatry appointments, usually foster children. I love my day job and I love my night writing job.
Arva?
Hi everyone, I'm Arva Bhavnagarwala. I'm a pediatrician based in Mumbai, India. And I began with my writing career with short stories, some of which have been featured in various literary magazines like the Hooghly Review and Active Muse. A Little Bit of Love is my debut novel published with Sherazad Shelves. It features main character Sadiq, who is an intern doing his internship at a very busy government setup in Mumbai. So this conversation is going to be really fun, keeping that in mind.
Wonderful. Now let's hear our introduction from Jenny.
Hi, I'm Jenny Allen. I am a nurse by trade. I work in a step down from ICU unit. I also write a supernatural forensic thriller series.
Wonderful. It's so lovely to meet all of you. Let me go ahead and we'll jump into our first question. Why is the healthcare system a pivotal part of world building? I'm going to start with Arva.
Yeah, so I think in whatever setting you are writing your novel in, be it a fantasy or a contemporary, your character is bound to get injured or fall sick at some point in time over the course of the story. So having a healthcare system in place while plotting your book is crucial because you don't know when you will need it. And then running to it at the end minute is going to make it chaotic. So if you have it planned from the beginning, that suppose if your character has certain illness or gets injured during some fight scene or anything, so you know how how the plot is going to move ahead, keeping that in mind. Right. So suppose if your character, it's fun actually more in a fantasy setting where the author can do whatever they want, however they want to build the world. No one is going to question them. In a contemporary setting, usually we need our characters to be more like do things that are real and we actually do in a proper hospital. So that we have an author has to keep that in mind. Another thing is, well, there are many kinds of the medical system is very vast. So there are many different kinds of doctors, nurses, paramedics, like it's vast. So I have watched a movie, I think, in which a veterinarian was treating animals as well as humans in a small village somewhere. So there is no harm in doing that, but you should know like the constraints of doing it as well. So yes, so that is what I feel. That is why planning a medical system while writing your story is important.
Nancy?
All right. Well, one thing I would like to comment is that if a country wants to be stable and, promote a healthy community, they would also have to consider having a healthy workforce. So, I mean, you have to also think about, it's not cheap to study medicine or nursing. It's not free. So imagine it doesn't matter if it's a fantasy world, you would have to have a school to train people to learn magic, to heal people. And, it's not going to be free. I mean, if you want to learn how to do a technique, you'd have to go to a clinic, hospital, whatever it is in the magical world, where people have to see a large amount of patients. I mean, the more patients you see, the better you get. You can't just be learning in a teeny tiny village. I mean, there are some books I've read where the people are self-taught and they kind of learned, this is all I know, this is what we get, and good luck. So that can also work. I mean, I've seen some really good books where people, they just self-teach, they learn on their own. And if they die, nobody sues them, it's okay. And in other books, they try to make it more complex. The lack of access to health care, the cost. I mean, you have to really consider everything for a world building. It's not just, oh, there it is, that's the problem. No, you have to build hospitals, maintain hospitals. They maybe want to tax the access to medicine. I've read a few books, they're pretty good, that mention that not everyone could get access to addictive medicines, and that's pretty interesting. You can cover lots of different aspects of healthcare in books, even also veterinary care. Maybe you want to write a book about dragon veterinarians. I mean, you don't have to just focus on humans. You could be a veterinarian that takes care of exotic animals, and you have to go to a dragon school, and now it's all of a sudden it's illegal to treat dragons, and now you're jobless. And now you're trying to do legal stuff. I mean, there's a lot of things. Healthcare is not just one thing. You could really expand things in different areas.
Jenny?
I think it's something that's sorely missed in a lot of fiction, but it's something that's very prevalent in our lives, more than people realize. The one thing that I do see a lot of is like incorrect treatments or super fast treatments that wouldn't really work. Shocking a flat line drives me insane. So, I mean, there's certain things, especially when you're talking about any kind of fiction where a character is going to get injured, which is, let's face it, most of fiction. You're going to have to deal with the medical system in some manner. So knowing how it works is very helpful for suspension of disbelief.
Well, you touched on the other speakers have touched on many topics, but something I wanted to bring up is it has to add to the plot, right? And so I, as someone who is in the medical field, always want to add as much knowledge as I have, right, into a story. But sometimes I have to realize that I need to pull back sometimes from all of the medical jargon, because if it doesn't serve the plot, it might not be relevant, right? But it depends on the type of story too. What kind of healthcare system? Like in fantasy, science fiction, those kind of things. The healthcare system is as grand or as minor as the imagination of the author. And then, of course, in contemporary settings or in, I've written several sort of urban fantasy stories where it's like the real world with a touch of the supernatural or the magic. Usually in those stories, the whatever crisis there is, if healthcare is involved, usually that is not touched by magic, right? That's just something that happens within the story. But usually I'm not adding to the magic of the story. However, in fantasy and science fiction, you really can expand. And I've seen stories where there are magical readers, where there are magical healers, right? Where they use potions or they use spells, right? Or, there's the kind of magic where what was the story? Mind healers actually read minds, right? I was just reading Ursula K. Guin's The Left Hand of Darkness, and in that story there's mind reading basically, and the Ursula K. Guin kind of describes the treatment of mental health like cutting blind if you couldn't mind read, which is funny because in real life we cannot mind read. And so a lot of psychiatry is kind of walking in a dark room and trying to figure out what to do next. So I like when I think of magic systems in healthcare, though, I don't want a one thing fix all, right? You still want that sort of balance of, well, this might work, but this doesn't work, or I need this herb to do this, but I don't have it, right? Sometimes when you have a magic system and a healthcare system, it's a little too easy to just wave a magic wand and say, you're fixed. Right. And sometimes that leaves the possibility of a lot of plot holes. So I tend to like harder magic systems where they kind of explain away the checks and balances, especially within a healthcare system.
Awesome. Yeah, I mean, that's definitely interesting how I think everyone kind of touches upon the idea of being realistic, but considering it in your planning process. Because if you don't think of it while you're writing, it doesn't mean it has to go in the book. You should, as the author, should at least know, okay, well, if they get injured, how are we going to repair this, right? And how are we going to fix this? So it's definitely something that seems important in the planning process, which kind of, I think you're touching upon, but it leads us to our next question, which is, what should authors keep in mind when planning or writing about healthcare systems? So on this one, I'm going to have Jenny start.
The complexity, knowing what to talk about and when to talk about it, knowing who does what jobs, and not just limited just to the hospital setting as well, but like doctors' offices, or even when you're talking about a coroner who does not go around interviewing suspects. Like, it just doesn't happen. So just knowing what different people's jobs are, it really helps to that believability.
Excellent. Vanessa?
So when I think of healthcare, because of my unique perspective, I often wish there was a magic wand that fixed all, right? But when I'm, thinking about healthcare and medicine, I, again, really think of the checks and balances. I really think of well, maybe someone of a different socioeconomic level would be able to do all of these things, but my character can't, right? Or maybe because my character is very wealthy, they could do all of these things, right? Or the disparity of the have and the have-nots, right, within a story. So that's something I really like to build in to any healthcare system that I'm writing. And sometimes I really think less is more, especially if you don't know a lot about healthcare. Maybe don't add all of these, don't add this whole system if you don't really understand how, you know, how healthcare works.
Exactly. Arva?
Yeah, so in my opinion, the whatever healthcare system you're planning depends on the country or the place where your story is set. Like if most of my stories are set in India, and here the healthcare system is very different compared to the West. An author writing an Indian setting has to keep that in mind. Like we have a private setup and we have a government setup. Usually the government setup is very crowded and it takes time to get an appointment. Private setup is faster but expensive. So you need to keep that in mind while planning your system. Another thing is if it is a fantasy or a dystopic setting, again, as the speakers said, that suppose if in a dystopian novel there is an elite class who has access to all the treatments available when they fall sick versus the poor class who don't have access, who have to struggle more. So all these things also have to be taken into consideration while plotting the book.
One thing I would like to comment, who is going to finance this system, right? I live in a country that is partially socialized, whereas you can freely choose to go to the private route. You can pay your own money. You can choose whichever healthcare professional you want. And, you know, it's your own money. You have the freedom to choose. But a lot of people don't have that kind of choice. So they have to choose a government hospital system. A lot of these hospital systems, they take a quota out of your paycheck. So it's partially financed by your paycheck. Partially you have to pay extra for the service, and the rest is paid by your government taxes. So you have to think about these things in your world building. You could also be more like Canada, where there's more limited options, where you're not allowed to use private sector. You have to wait and let them choose, make them decide who you're going to be treated. I mean, you could have a NEDUS test, and then the only person that you can get the consult with, they're going to say, nope, nah, you don't need it. And so you're just waiting months and months and months. There's a lot of different ideas that you can explore with world building and healthcare systems. You also have to consider that it's not just one expense. Okay, governments love to build hospitals. Very nice, very pretty, very cheeky. Guess what? You have to maintain them. Elevators need to be fixed. The lighting needs to be fixed. The machines need to be fixed. I mean, every 6 months you have to keep these ventilators in tip-top condition. If not, the insurance of the machines, they expire, and medications get expired. You have to throw them away. And then all of a sudden you also have to get rid of waste. I mean, there's a lot of things that even in a fantasy world, you might have to consider. Maybe you have a dragon hospital, and all of a sudden, all the operating rooms are not for big dinosaurs or big dragons. You only have space for tiny dragons. What are you going to do now? You're going to put them in a gigantic CAT scanner, or, you know, another thing that you should consider, not every healthcare book has to be about doctors or nurses. There's other healthcare professionals in the hospital system. There's the bean cutters that will decide how to finance everything. And you could just go to complain and they're like, oops, I'm sorry, there's no budget. Oops, I'm not here today, I have to go to a meeting. I mean, you can make a lot of different things in your story that can be very interesting. You could maybe have a celebrity, the king shows up for a special meeting, and everything, all of a sudden, everything is perfect, everything is clean. All of the beds are new and everything is very nice. They show up for a photo, and then the king leaves and everything is bad again. I mean, there's a lot of ideas you can think about. I mean, it doesn't have to just be perfect. I mean, maybe there's a storm, a magical storm, and all of a sudden things get damaged. I mean, you could also use magic to try to fix things, and maybe there's like a consequence with the magic where all of a sudden you fix one thing, but another thing goes wrong. I mean, there's tons of ideas that you can explore. I mean, remember, this is a job like anything else. I mean, you just go to work, you have your lockers, or, you know, my job, we don't have enough lockers. So that's a pretty huge problem. That's very real. So there's a lot of ideas you can think about. I mean, it doesn't have to just be doctors and nurses. I mean, you could also have X-ray techs. cafeteria workers. There's a lot of other options, an important thing is to think about how to finance it, all of these other aspects that are very important in books.
Yeah, I mean, those are definitely great points that you guys make out, that you think you have to consider the socioeconomic climate of your world. Where even if your characters aren't involved in it, as an author, you should definitely ask yourself that question and take it into consideration, because it's going to impact how certain decisions can be made. And like, is this relevant to the plot? Can it happen? Where is my character, and how do they fit in within the society that you've developed? And that kind of leads us into this next question for the group, which is, what are some of the common misconceptions you've encountered in this particular area? I'm going to start, Vanessa.
So some misconception, well, one big misconception that can pull me right out of a story is if the doctor is doing everything, right? If it's just one doctor doing everything, because so often we see that presented in media, especially shows centered around healthcare. It's always the doctor's doing everything. I'm sorry, a doctor's not putting in a catheter, right? Like, where are the nurses? Where's the like ER techs? Where's the pharmaceutical techs? Like, where's lab? You know what I mean? I know that to tell the story, they want to focus on certain characters, but a little bit of realism would be nice, especially in an urban setting, right? And I see the same thing in fantastical stories. There's like there's one person who does all the magic and all of the healing, right? And that just isn't that realistic, right? I mean, I play D&D, right? Dungeons and Dragons. And yes, in a band of like 3 people, it would be nice to have one healer. But the fact is, we're all kind of helping each other. And healthcare is kind of the same way. You know, everyone has their little piece to play. And I would like to see that represented more often, especially because, you know, and this is a practical reason, but you talk to kids and they're always like, oh, well, I want to be a neurosurgeon because that's like the only exposure they have, or whatever. But there's so many different avenues within healthcare to be able to still, you know, be involved in healthcare, but not have that one job, right? So I think that's really the biggest misconception that kind of gets under my skin.
Awesome. Jenny?
Incorrect policies. When you have a character that is suffers from a gunshot wound and they go into an emergency room and walk out like an hour later, like that's not how any of that works. And every single gunshot has to be reported to the police. So if you have a society like in my books where you have supernatural creatures trying to stay under the radar, you have to be very careful with medical areas, because it's all about identity and reporting violent crimes. So you have to know how the system works to work around it properly.
All
Nancy?
right. All right. I have a really huge pet peeve with the TV show Dr. House.
Oh,
I know, I mean, it's a fun show. I do like it, but I just think it's so unreal that the doctors are now doing the X-ray tech, and then they're doing the lab tests. I mean, then they're one of them is a pediatrician, and then you see him seeing adult patients every episode. I'm like, you know, in the real world, you just select one specialty, and then that's all you see. You're gonna just see the same kind of like 20 diagnoses over and over and over. Nurses too, maybe they'll still remember the general nursing techniques and taking care of patients in beds. But some nurses, they're going to be training for years to just work in the operating room. They don't leave. They work in the operating room every day, and they don't go to other sectors of the hospital. ICU nurses, they'll also stay in their ICUs. I mean, that's a huge consideration that for world building. I mean, if you were going to make a book where it's a fantasy world with mages that use medicine and stuff. Maybe you're just going to separate them by techniques where everyone only knows potions and they'll know everything about every potion that could ever exist, but they only know potions. They don't know how to fix a bone, but they know potions for poison. I mean, they're the specialists for curses and poisons in the world, in the kingdom. That's all they know. That's all they like. That's all they care about. Maybe they'll be a bit familiar with some things that are crossover, a poison that damages bones, but they won't fix that. So these are things that should be very important, that maybe a person that knows a human healthcare might not know exactly how to treat a dragon. And they're like, oh my, I don't know what diseases dragons get. What do they get? You know, vaccines, like, how do you put an injection in a dragon? Or I don't know, you can make a lot of other different situations in books where things can be very creative. I mean, I think I would be very identified if people stick to the area that they know, but maybe things go wrong. The only technician that knows this thing, that does this procedure, is on vacation. And you're like, oh my, all weekend, I can't do it. I don't know what we're going to do. And then the people above you are saying, no, you have to treat the patient. You have to treat them because they can't just be discharged. So you're kind of like, you know, what do I do now? There are situations that are very common in real life, and I would like to see a bit more in books. Also, I always see on TV shows ER medicine, surgeons are like the only two specialties that I'll ever see on TV. I mean, yeah, it's true. You will see ER doctors and surgeons, but there's other specialties. You can be psychiatrists. You can be radiologists. They just stick to seeing x-rays, doing procedures, and they only stick to those areas in my field, anesthesiology. We live in the OR, we have our little room. We never leave that room. And I mean, if there's no procedures, we just wait and we don't have to do anything. But we might have a few patients in the wards, but we discharge them. They're no longer in pain and they don't need any of our help. And then we leave. We have a very set job, very specific skills that overlap a little bit, but we just kind of stick to our area. And I never really see anesthesiologists represented in fiction. I think the only anesthesiologist I've ever seen in TV is the one in Nip Tuck. And I always make fun of the character and like, oh, that's so mean. She's so nice. Why are people being so mean to her?
Right. Yeah, that's very true when you think of how they use healthcare within fiction and definitely in media and in TV shows. It's like you can magically solve everything, and as somebody is so irreplaceable, or they can go and it's interchangeable, all the roles are interchangeable. But that definitely doesn't ring true. Where that doesn't really happen. Anyone who's been to any kind of hospital knows that they just move you station to station to station. So
oh no, and then they get angry at your coworkers. Like you might have like another surgeon that has like a really explosive personality. Like, why didn't they have person? I don't know. They're very anemic. I don't think it would be a very good idea to operate so quickly if they can do the blood transfusion, because a lot of things get delayed. There's no ink, or for example, in the hospital system and where I work, nothing is digital. Everything is by typewriter. Everything is by hand. Everything is by paper. So they don't request the paper, the patient chart in the chart room before 3 p.m. Sorry, there's a lot of noise. If the chart is not available before 3 p.m., well, guess what? The chart will never appear and the patient has to be discharged, and please come back tomorrow. So it's also these kinds of events that are kind of unanticipated, and like, you know, it's not exactly my fault. I mean, I'd like to help, but if you start over helping everyone, they start thinking, oh, you're gonna have to do everyone's job, and you know, it's kind of, you know, it's probably not a very good idea. You have to, you know, do your own job, and if a surgery has to be delayed a day, well, that's how it is in real life. So I would like to see that a little bit more often in books.
great. Arva?
What I think is what's not shown enough is a balance between the personal lives and professional life in a doctor's life. Like, I know, I understand that it's really difficult even in real life, especially when we are studying. We really work odd hours. Like, I've even mentioned this in my debut novel, how the intern works 56 hours at a stretch. But apart from that, once they are done with all their studies, there definitely is a balance in their professional and personal lives. I think that has not been explored enough in books that I've read. So that is one thing which authors should keep in mind if their main character is a doctor. Maybe show something outside the hospital setting, what other hobbies they can have, what other things they can do.
Great. Yeah, I think you all kind of touched on the same ideas, the realism behind it. And I love how we always, even though we love reading fantasies, watching dramas, it's natural to sit there and go, that's so unrealistic. And it's like, but I'm okay with the dragons flying across, and I'm okay with the magic that can just like snap, you know, the magician can snap their fingers, and the healers who are like, boom, there you go. I can just fix it all. So it's so interesting how we have the same, like, it sounds like everyone has similar pet peeves, and it deals with these issues of realism, and just practicalism, and gaining or granting a larger exposure to the multiple positions in healthcare that's available, which I think also kind of ties in to our next question, which is, what are some tropes or cliches that you've noticed writers need to stop using? Right? I'm going to start with Arva on this one.
Yeah, so the most common thing which I think is head injury followed by memory loss. It's too, it's overused, and I think we should find other things now to explore in medical injuries or systems. Another thing is, of course, Nancy has mentioned that a pregnant lady, water broke and she delivered in 5 minutes. It doesn't really happen that way. Most of the time, the water doesn't even break naturally. It has to be induced. So that is another common overused trope, in my opinion. Another thing is, if your character is a specialist, like suppose if your character is an ophthalmologist, he or she wouldn't be able to treat something else because they are usually trained in that particular field for quite a number of years. So the other things usually take a back seat. So you can't expect an ophthalmologist to treat a heart attack, for example. So that also has to be kept in mind.
One of my big pet peeves is when the water breaks in a pregnant woman and she's about to have birth. I mean, that is like the biggest trope that I've ever seen. She's like, oh, I have pain, and the water is broken, and 2 minutes later, and the baby's going to be born in 2 minutes. I mean, it can happen. I've seen it happen a few times, but it's like, that's not what typically happens. She'll start having a lot of pain, and it'll get increasing. And what's more common is that the patient will show up in the ER and they're saying, yeah, you have pain, but it's not yet regular enough. Please come back tomorrow. And please come back tomorrow. And then she's coming over and over and over again, several days in a row, until finally the birth is finally, starting for real. So I never really see that in books. And one thing that I would like to mention is that when you specialize, some of your skill sets, since there's just so much knowledge in medicine. I mean, just in my field, just medicine, it's just so much knowledge. Nobody will ever learn everything. You'll forget. There's just too much, and the amount of new articles being published every day, nobody would be able to read everything. So obviously, when you specialize, you just focus on specific diseases and special techniques, and some things you're going to forget. You'll forget things that you haven't been doing in 10 years, and it's natural. So it's another thing that's kind of fun to see in TV. I've seen it done pretty well on TV when there was this episode, I think it was in Chicago Med, I don't know, they were like in a pharmacy, and then a criminal is, kidnapping everyone, and there's the woman giving birth, very cliche. And then they're asking this poor guy, I don't know. I don't remember if it was a nurse or a doctor, but I think it was like ER. and the person hasn't attended births in like 10 years. Like, oh, I mean, I do remember, but oh, do we really have to do this? And that is pretty real. Like, oh my, really? This is not really not exactly easy. I don't. I mean, I do remember, but it's. I mean, come on, let her go. Let the patient go. I mean, you could just keep us here. So I think those are tropes that I would like to see a little bit more often. That a little bit more research in that area. I mean, that's like my pet peeve. I mean, other people will say, you know, other things. I don't really mind other things, but I mean, that one really always gets to me. Like the vaginal birth one. It's so cliche.
Yeah, that's an interesting example. And you always think of it, this notion of a woman's water breaking, and it's like this big, huge puddle on the floor, and it's like, no, that doesn't always happen, and it's more not very common that you're just walking and all of a sudden, gosh, all this big puddle coming out. So that's a good one. That's totally a good one.
My number one pet peeve of all time is a deep stab wound to the abdomen that they simply sew the skin up and it's magically okay. All that does is close it up so all the internal bleeding just collects underneath the skin. Like, it drives me insane. I can't stand it, especially when they have medical professionals doing it and not just the characters themselves. And just, it's not how this works. Knowing what goes to the operating room and what can be handled in the setting that they're in is also very important.
Vanessa?
I'm just gonna kind of add to what everyone else has said, which is that trope of like, if you know medicine, you can do it all, right? And the thing that always I think is hilarious is, you know, if someone is choking or something and they put like they cut a hole into their throat with a straw or a pen or whatever. I'm sorry, but I'm a medical professional, and if you ask me to do that, I would not do it, or I'd kill the person. Like, I'm not going to be able to do that. I'm not trained to do these kinds of things. But you know, again, maybe I'm going to do a little bit of a catch-20 or a flip to what everyone else has said, which is that, you know, something I said earlier, which is if it serves the plot, right? And that's why they overuse these specific, the head injury or the water breaking, because it adds to the drama, even though it's some small percentage of people that this actually happens to. It happens to your character because then it can make X, Y, and Z happen later, right? Which, you know, I got a little chuckle out of, because I actually, when I delivered my children, my water broke first. I went from, you know, not feeling contractions to water breaking to like 3 hours later, I had a baby, basically. So I was one of that like 2% of births that happen like that. But yeah, I see the reason why these are overused again and again and again, because they serve a plot, right?
Yeah, the pregnancy one is really interesting. And then it's like, I guess you never think of it. And then it's probably also like having a baby in the elevator, or like getting in the taxi and delivering the baby. Like, so yeah, does that really happen? I don't know what percentage that really happens, but the water breaking, I know I had 2 kids. My water broke at the hospital, but I was definitely both deliveries. We were fortunate enough to live close enough to the hospital, where it's a 10-minute drive and my contractions are so far along. I'm walking in and they are delivered within the hour. So I didn't have to linger. I was lucky both times, not having to linger around, feeling all the pains, being stuck in these rooms, waiting, saying like, are you ready yet? And then they came, I think my son came, and like the doctor wasn't even there yet because they had to drive in. And so it was just whoever the on staff delivery doctor was. So it's like that idea. It's so interesting how we have these moments or these preconceived notions of how it is. And that's because it does feel more dramatic for everyone. So when we understand kind of what cliches you want people to stop using, that leads into our next question is, what would all of you like to see more of in books regarding medical systems? I think we've touched upon a few topics of those, but definitely we want to hear what do we want to see more of, right? Let me start. Arva?
Yes, so apart from the usual physician, surgeon, neurosurgeon, we would like to see more paramedical staff. Show me your physiotherapists, your occupational therapists, psychiatrists. I think we see those nowadays. But yes, what about the lab technicians, the radiologists, the people who conduct X-rays? Like everybody has a story to tell, right? What about the ward boys? Show me those people. What about the hospital setup has a lot of departments, the accounting department, the HR, the management. All of these also play an important role in the entire healthcare system. So show me those characters. Like I'll give my own example. The next book that I'm querying has an anesthesiologist as the main character. So, so yes. So if once the people are exposed to the other specialties, maybe when you ask a child the next time, what do you want to be when you grow up, they would probably take a separate name other than just a neurosurgeon or a cardiologist or whatever. So yes. So showing these diverse people in the healthcare system should be like taken up by people who like writing such characters.
Vanessa?
This is probably going to be an obvious answer from me because I work in psychiatry, but mental health treatment. I mean, goodness gracious, so many of the characters that I read about could do with some therapy or some anti-anxiety meds or something, right? But you can make it serve the story, right? It doesn't just need to be there because, we need representation of it. It can serve a story. I've read several stories recently where it featured mental health treatment that added to the story. And then along the same vein, I wrote a kind of a novella that I'm querying right now. And the main character is a 12-year-old who is attending therapy. And she's attending therapy because she's been seeing things. And I based a lot of their sessions on, a lot of the sessions that I've sat in on. And it's funny because I had a lot of beta readers read it and everyone had an opinion. They thought the psychiatrist was, not understanding enough or too understanding or too this or too much of that. But they're people too, right? And that therapist has her own story within the tale, right? So I just thought that was interesting. But that's something that I really wish I saw more of. To add to that too, accommodations for children in stories, right? If you're one of the biggest, types of stories that was popular in the last 20 or so years is like the, magic school type thing. Well, where are the accommodations for the, atypical kids, right? They definitely are represented within the population of the student body. I can think of several offhand. But you see them bullied. You see them at the bottom of their class. You see them becoming bullies, right? And just like healthcare isn't just the doctor, right? Schools and mental health treatment isn't just, one size fits all, right? So I would like to see more of just all around mental health represented in media.
I think we definitely see, like I'm trying to remember, I'm confusing two different authors who I've met through WriteHive, but I'm sure on the day I'll be able to drop it in the board because I will look it up and I'll know it by then. But she definitely incorporates mental health representation in all of her stories. It's a key theme in all of her books. And so like when you're talking about the mental health representation, like first thing that comes to mind is the perks of being a wallflower. For me, it's like I remember reading that and it's like as especially targeting for kids, you like you think of post-pandemic, during pandemic, so much of the mental health issues and the wellness things. For me, being a parent now is terrifying because I never had to deal with lockdowns or school shootings, and that fear of students having to be exposed, and they're like the kids must grow up way faster than I felt like I had to 30 years, 40 years ago. And so they're dealing with different things and letting them know that there are avenues for them, and that it's not something to be ashamed of, I think is really, really important. And so I like that in terms of being a middle grade author, writing for those kids, letting them know that it's okay to feel these things. It's okay to ask somebody, and having that representation in addition to the wider breadth of healthcare system options out there in terms of career choices. It's like we want to look at the positive. We don't want to dwell on the negatives too much, but normalizing those things is really important. And I think seeing that is so critical, for all new readers. And we have people here in WriteHive, the WriteHive community. You guys are all touching on those things.
One thing I would like is to see more variety in healthcare worker professions. I've never seen a language interpreter, for example. Never, never, never. You know, it'd be very interesting. You know, you can create a fantasy world where this person only knows dragon speak, and you have like this magical person with this strange magical disease, and the only people that can understand it are certain interpreters. And if you get it the diagnosis wrong because you don't speak the right language, it could be very terrible. Maybe like a magic debt or a curse or something could really happen. So that would be very cool to see other fields. It's not just, you know, doctor, nurse, you know, there's other fields that could be very important. Rehabilitation workers. I don't see those often either. There's like, I've only seen one movie with a physiotherapist. It was a one with Queen Latifah. So it's an okay movie. She takes care of a NBA basketball player, suffers from a terrible injury, and then they fall in love. So that movie, it's not like the best movie, but I think if the script was a little bit better, it would have been really great. But I love the idea of seeing a physiotherapist represented in a story. That's very fun. It would be very different. You know, maybe as an old knight warrior that got in a horrible injury, you know, maybe you can make a love story. I don't know. These things, these tropes are, I mean, you can vary things a lot in other fields. That would be very nice to see.
Jenny?
I know we're all pretty much going to touch on this, but proper representation in the medical setting. Doctors don't do much of anything except write prescriptions, and sometimes make a diagnosis, usually from all the reports and everything that he gets from the nurse. Just knowing how crucial nurses are, we need some love in fiction. Like I don't think there's enough love for nurses in fiction and all the things that they do. Also knowing the settings, the different types of healthcare that there are, what goes to ICU, how long they stay in ICU, what do they go after ICU, especially when you want to draw on emotional connections. It's important to properly describe that environment and the feelings that come with it, the reactions that family members have when they come into an ICU setting. Like, I mean, all those things are important to that. Suspension of disbelief is the number one thing in fiction.
So this has been such an amazing talk. I've got one last question for the group, and it is, how detailed do you think authors should get in their medical descriptions? I'm going to start with Jenny.
This is a fun one. I was looking forward to this question. So my main character is a CSI. She knows a lot about anatomy and things like that. She does actually do a cursory investigation of the bodies because of this certain type of CSI that she is. I do use a lot of technical terms when it comes to locations on the body, things like that, but it's also paired with descriptions or reasoning behind those wounds that immediately tells the reader where that thing is. So they get her level of knowledge, but they're not lost. And like keeping that balance is important. But it all comes down to what the character. Are they professionally trained? Do they just have a cursory amount of knowledge? Like what is their depth? And it should be appropriate to that specific character. As for the world itself, less is more is definitely the best way to go. But it just depends on how important that atmosphere is to your story as well. So it comes down to a lot of different factors and finding that delicate balance. The best thing is to have test readers that can read your stuff that don't have any medical background. And they will definitely let you know if they need more explanation or if they need less explanation. So yeah, to find that helpful, delicate balance.
I'm like, as long as it's well researched. I don't know. Some people will be very squeamish about blood and gore, and you should also take into consideration trigger warnings. I mean, there are people that are obviously, very, uncomfortable with pus and amputations, and that's perfectly fine. So writers might need to consider that maybe if you're going to write a children's book, maybe getting a little bit too graphic with descriptions might scare some children. Maybe, for example, horror books for adults would probably be more likely that they can be more visceral descriptions of pain and ligaments. I think you should consider the kind of audience you want. And another thing should be, if you have doubts, you should, there are like sensitivity readers that specialize in a specific area of healthcare and in a specific country, because guess what? Medicines might exist in one country and not another. So there's a lot of medications that are not available in my country. So if you're going to make a story taking place in a specific country and you're putting a drug that's not available anywhere, people are going to notice and they're going to be like, this doesn't exist. This is kind of unreal. So it would be best if you can get some people to keep their eyes open and say, this isn't available. This is very expensive. You're not going to have it easily, but we do have it. You can, do changes in the book to make it more realistic and credible, because readers will notice these things.
Vanessa?
Well, I'm going to go with less is more. Even as someone in the healthcare world that is knowledgeable, I will sometimes write a scene and then try to put on my non-medical glasses and be like, what do I need to take out of this scene? Okay, they don't need to know that there are 3 bags of antibiotics hanging and the isolation gown is, takes this long to put on, whatever bits that I added, because that is how I visualize the scene. Sometimes less is more. Let the story be let the story speak for itself and kind of pull back a little bit. At least that's the advice I need to give myself when writing medical anything, right? But another reason for that is the more detailed you get, the more a reader is able to be like, well, that's not, how I see it, or that's not how this would be done. I mean, I had a character in that story I was that I have on submission on query right now, about the kid attending therapy because she's been seeing things. And I had one of my beta readers mention, oh, well, if she's seeing things like, they really should have done an MRI because blah, 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 blah. And I didn't want to argue and say, well, this is my job and we're not going to order MRIs for everyone who sees something. But I realized when she said that I needed to pull back on everything that I was saying because I was giving too many details, right? Sometimes less is more.
Awesome. Arva?
Yes, so as Vanessa said, it depends on the genre of the story. If it's a horror story, maybe you can give in more gory details about the injury or any operation, whatever is going on. But if it's a contemporary setting, I agree, less is more. You just need to provide the basic details for the reader to grasp through what is going on in the story. Unless it serves some plot and you need to really mention how long the surgery took or what exactly happened. So it all depends on your setting and on your story.
I think you need to consider your end user or the end reader and your target audience. Because I can't imagine being super specific on medical stuff for middle grade kids. Like, yeah, I have magic systems, so I do get to just magic wand it away. Do I have the knowledge? Oh, yeah, I went and I studied, and so I've got a master's degree in it. So I kind of know the terminology and I love the words and I want to be detailed. But I perhaps taking into consideration our end reader and the audiences, I think it fits along the lines of, does it work in your story? You don't need to you're not impressing anybody with your big words. They're just gonna blip over it when they're reading it. But wonderful. Well, you guys, this has been so informative and so delightful. Before we end, I want to give you guys an opportunity to plug. Where can we find you? Tell us what you're working on. Where can we get your books? So I'm going to start with Arva.
So Little Bit of Love is my debut novel and it's available across all e-retailers. In India, we have a special hardback edition, which only I have and I can provide if the readers want. And apart from that, I'm currently querying a romance, an adult contemporary romance set in Mumbai again, in which the main character is an anesthesiologist and she fake dates an OTT actor by accident and ends up falling for him, unaware of the visible secret he so cleverly hides. So again, that has a little bit of medical stuff in it, but I enjoyed writing it and I hope someone or the other picks it up and the readers get to read about it. I'm there on Instagram and X as Arva Writes, so you can follow me there.
Nancy?
I am a bit chaotic. I probably work in like 5, 6, 8 projects at the same time. For example, Fragmented Fates, it's gonna participate in the BBNYA competition. I always call it Bananilla one. I don't know, you kind of get confused by the initials. So that one's going to be competing. I'm still translating it to Spanish, so it's kind of slow. I'm busy on so many other things that haven't. It's like probably 60% translated. But I just released Savior in the Senate, the sequel. I'll probably end up translating that one to Spanish too. Right now, I'm working on a collection of short stories of horror. Never really published horror before. Some of the stories are in Spanish. I've noticed that it's easier for me to translate from Spanish to English. I kind of like the way the translations go, a little bit more fluid. So I'm kind of working on that, and also in a sci-fi fantasy story. I'm very terrible with romance. Every time I know people love romance books. Every time I try to write it, I make sure that the couple dies at the end or they break up. I'm really bad. I'm terrible in that sense. But I kind of one of these days I do have some stories that are kind of more romance where they do stay together. They're kind of starting to write them. But I don't know when I'm going to be releasing them. But I am going to try to put an effort in doing, romance stories because I know people love to read them, but I'm just really terrible at that. But I'm working on several stuff. Okay.
And where can we find you? Are you online?
I'm probably chronically online on Twitter. Well, it's supposed to still be Twitter. Dr. Foxter instead of Foster with an X. It's with an X. That's a nickname a person from one of my old jobs used to call me. So they kind of like I needed to open an account for another reason. I left my account abandoned for years before I started really publishing books. And then I'm like, I only opened an account for like one simple thing, and then I forgot about it. Like, oh, I'll just stick to it. It's fine.
Jenny?
So I am on TikTok and Facebook, Jenny Ellen Books. You can find me that way. Also, my website, jennyellenbooks.com. Nice and easy. Currently, I am writing book 5 in my series. Book 4 in my series is with my editor and will be releasing this July, and that's Ghost Orchid. And the series starts with Blood Lily.
Hi, so you can find me on Instagram at Vanessa.ofalltrades. Again, that's Vanessa.ofalltrades. I'm doing a lot of random things. I have my debut novel, which came out last year. It's also up for an Indie Ink Award. So knock on wood, hope cross your fingers for me. It's called Play It Back. It's about a 27-year-old Filipino American woman who goes to her high school reunion, has a head injury, and gets thrown 10 years in the past to relive her senior year of high school in 1999. So it's got this, like, of course it's got that little trope in, right? And so in 1999, she's dealing with low technology, no cell phone in her pocket, right? Dealing with high school all over again, dealing with her first gen Filipino parents. And there's a little bit of romance, a little bit of medical something going on, and a whole lot of, kind of doing it all over again. And I am currently working on a children's book. I'm doing the illustrating and the writing for it. So I've been working on that. I'm also querying a middle grade book about a little girl who sees ghosts and goes to therapy for it. And my website for all of my random projects is www.vanessalopezaziz.com. Again, that's vanessalopezaziz.com. And I've got my art up on there. I've got my Etsy shop with stickers. I've got links to buy my book that's currently out. And it is through Mystic Publishing. So it's available in paperback. You can buy it on Amazon, Barnes and Noble. It's also available on ebook, on Kindle, Nook, all of those devices. Hopefully we'll be on Audible someday. And I think that's all the projects I'm working on currently.
Well, thank you guys so much. I hope you guys have learned as much as I have from this panel. Feel free, if you guys have questions, try to leave them in the board. We'll get to them. If they can answer them during this reviewing of it, we'll definitely do so. But thank you guys all so much for participating, and we'll see you and enjoy the rest of the conference. Take care.